It just felt like nobody could help me, nobody had answers, and that I stood alone.
I felt like I was being tortured.
She did say to me several times, "Mommy, I'm really scared."
It was in his eyes. He was looking at me like he didn't know who I was.
I basically became my own doctor at that point.
Next, two medical mysteries that defied the experts. 19-year-old Meredith Estus can't wait to get to college. But just a week after arriving on campus, she finds herself fighting for her life in an operating room.
Whenever somebody encounters somebody who becomes so sick in such a short period of time, we know that unless we act quickly, devastation may occur.
At 27, Douglas Posnanski has it all. But then a string of bizarre ailments and ER visits leads this once healthy man to believe he's dying.
I just sat there, pounding my fist literally on the table saying, there's something wrong. It's physical, and you're gonna figure it out when I'm dead.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. August of 2005, Meredith Estus has just turned 19. She's getting ready to leave home for her freshman year of college.
The summer before going to school, it was exciting because I was working, traveling a lot with my family, and then kind of spending as much time as I could with my friends because it was like our last summer together.
It was a time of transition because she knew that she was moving from one part of her life into another part. So a lot was happening, and as a parent, it was kind of bittersweet.
But amidst the excitement of packing and preparing, Meredith begins to complain of a sore throat.
I thought it probably wouldn't be that big of a deal because I had been kind of going out a lot, so I was like, oh, maybe I'm just kind of feeling under the weather because of that. And I think my friends, they weren't feeling the best either.
But as her friends begin to get better, Meredith's sore throat lingers. Eventually, she goes to see her family doctor.
And she basically told me that what I had was most likely just like some sort of virus or something going around, that best I could do, just kind of relax.
Meredith bides her time, assuming the sickness will pass. But it doesn't.
She continued to complain of a sore throat. She indicated that she had headaches. Also, sleeping a little bit more often than usual. Meredith doesn't require much sleep.
I started waking up, I'd be like in a hot sweat. At that time, my mouth was getting hard to open, so I would just kind of sit there and just be like, what is wrong with me? Why do I feel so sick?
A concerned Christy schedules another appointment at the pediatrician on September 2nd, the day before Meredith is due to leave for school.
I was leaving on Saturday, so the Friday, my last Friday, back in St. Paul, I went to the doctor again. They tested me for mono and they tested me for strep throat, and both of the tests came out negative.
Despite being sick for a week, the negative test results leave her feeling reassured. Meredith then directs her attention to getting all the last-minute details in place before the big move.
Meredith likes to make lots of lists. I noticed that she had made a list for some of the things that she was supposed to do for college, and I think number 6 or 7 was get better.
But when the day to drop Meredith off at school finally arrives, she can barely get herself out of bed. She manages to make it through the 2-hour ride to campus, but over her first few days at school, Meredith's health continues to deteriorate.
My tonsils were still bothering me, and not only were they enlarged, but like the left side of my face was getting kind of swollen too. I still couldn't open my mouth.
Her energy level was a lot lower. She didn't really want to go out, or she couldn't. She was sleeping a lot, and she wasn't eating very much, so she wasn't her normal self.
I remember waking up Saturday night in the middle of the night, still not feeling good. I think I had like a fever, and I remember like throwing up just in the middle of the room.
When I called her on Sunday, again, she said she wasn't feeling well. She hadn't done many of the social activities at school.
An alarmed Christy decides to take action and calls the local children's hospital hotline.
It wasn't long before the nurse went off the line and spoke to the doctor and got back on and said, your daughter is showing symptoms of a paratonsillar abscess, and she should be seen by an emergency room within the next 2 hours.
A paratonsillar abscess is an infected collection of pus that forms alongside the tonsils. If untreated, the infection can spread throughout the throat and obstruct the airway. Christy calls Meredith right away.
My mom was like, all right, I think you should go to the emergency room because you need to get this figured out.
At the ER, the doctor administers a strep test and conducts 2 CT scans to check for a paratonsillar abscess, but all the results are negative.
When I spoke to the emergency room doctor, he said he did not have a paratonsillar abscess. I felt a little bit reassured, yet I still felt worried. I mean, this was opening weekend of college, and here I had a child that had just been to the emergency room.
Meredith is diagnosed with tonsillitis and sent home with an antibiotic.
They're like, oh, you know what, you might not feel it, but after about a day or two, it's gonna kick in and you're gonna start to get better. I went to bed hoping that everything was gonna be just fine.
But the next morning, the first day of classes, Meredith feels worse and has developed an alarming new symptom.
That's when my memory started to disappear, like my short-term and my long-term. My memory was just kind of like fading away.
When classes started, Meredith would get really confused trying to go to class.
I remember that day I had carried a piece of paper around with me, like marking down where I would go. Like I would like walk straight down the hall, then at this point take a left, and then walk through some people, and then take a right.
She couldn't figure it out, and she would stop and ask random people if they could help her get to her class, which isn't something she would normally do.
Then Ashley notices something else.
Her head was actually, it looked deformed, and I realized that she just seemed really out of it, really spacey. And then when I started making all the connections that she wasn't remembering things either, that's when I called Christy.
Not only was I worried about Meredith, but her friends were worried, and she was not herself. When I called Student Health Services, I gave them a brief summary, and they were probably thinking, oh, this is a mother that's just a little bit overly concerned, but they were willing to see Meredith the first thing the next morning. I called Ashley and made arrangements so Ashley could go with her.
And then the doctor actually had me come in the room with them, and she did a couple tests. Then she left, and our friend Maggie actually called, and I told Meredith, I said, Maggie says hi, and she hopes you feel better. And Meredith kind of gave me a really confused look and was like, well, who's Maggie? And that's when I got really upset, and I knew that something was really, really wrong because Maggie was one of Meredith's best friends.
"19-year-old Meredith Estus is in her campus health center waiting for the results of blood tests. Just 9 days ago, she was perfectly healthy. Now she is suffering from an aggressive sore throat, delirium, and appears to have a swelling in the front part of her head.
It just looked like the top half of the left side of her face was bigger than the rest.
Meredith's mother, Christy, anxiously waits by the phone for the results of the blood work.
I got a call immediately saying that Meredith had low potassium levels, that she had a very high white blood cell count, and that she had a worrisome swollen left temporal area, and that she was making arrangements to have Meredith transported immediately to one of the emergency rooms in town. I grabbed a few things, and I was on my way.
When Meredith arrives at the ER, doctors discover she has developed a paratonsillar abscess after all. The only treatment is surgical drainage.
I remember them like having to cut like the back of my throat. They were trying to see if they could drain anything out, and they started doing it, and like it was bleeding a lot, and I remember crying because it hurt so bad.
A very apprehensive Christy is on the 2-hour drive to Duluth when she receives a phone call.
I picked up my cell phone. It was the ear, nose, and throat doctor, and he said, we have just drained Meredith's paratonsillar abscess. I felt a little bit relieved because I thought, oh, well, she did have a paratonsillar abscess now, and it's drained, and maybe now she can start getting better.
After draining the abscess, the doctors quickly move to determine the cause of Meredith's swollen forehead. They order a CAT scan of her brain and call in neurosurgeon Stefan Konasevich to consult.
When I first met Meredith, I saw that she had a lot of facial swelling. She had a lot of word-finding difficulty. She had trouble remembering a few phrases. She had a tremendous amount of pain in and around her head. She had not only speech deficits, but was having some problems with her vision. Whenever somebody encounters somebody who becomes so sick in such a short period of time as Meredith, as neurosurgeons, we know that unless we act quickly, devastation may occur.
The CAT scans soon come back with grim results. Meredith has an abnormality in the left temporal portion of her brain.
The most likely diagnosis was that of a brain abscess located in the left temporal lobe.
A brain abscess occurs when an organism, such as a bacteria or fungus, infects the brain. Normally, an abscess can be treated with antibiotics and, in more developed cases, surgery. If left untreated, the intracranial pressure caused by the mass can lead to death.
They're common occasionally in people who are immunocompromised. We rarely see patients, such as Meredith, who are young and healthy adults.
Christy is almost to Duluth when she receives a second call.
And the call began, Mrs. Estus, this is Dr. Stefan Konasevich. I'm a neurosurgeon. And when I heard the word neurosurgeon, I just felt my heart sink, because in the next breath he said, your daughter is being prepped for brain surgery. I don't know what allowed me to continue to drive rather than going into the ditch, but it was just a real sense of, this is unbelievable. We dropped Meredith off, it was on a Saturday, and by that next Thursday I was on my way to see her in the emergency room.
Within 30 minutes, I had Meredith ready to undergo stereotactic aspiration of the brain abscess.
In order to see the brain in 3 dimensions, a metal device called a stereotactic frame is attached to Meredith's head at 4 points. Meredith is then put through a CAT scan, where the frame provides the fixed external reference point for the internal images shown on the scan. With both the interior and exterior of Meredith's head visualized at the same time, the precise location of the abscess can be identified, and Dr. Konasevich can devise a plan of attack.
With the CAT scan and the frame in place, we are able to identify the best target entry for entering that brain abscess to minimize the type of surgery the patient has, and also to be as very accurate as possible.
Dr. Konasevich successfully drains a large amount of pus from Meredith's brain, but Meredith is still in danger of having a relapse if the doctors can't determine what's causing the abscess and treat it.
I had contacted the infectious disease doctor, Dr. Linda Vanetta, who I had asked to look carefully at the microorganisms and or bugs that were potentially causing this abscess in the brain.
Usually a brain abscess is due to one or more bacteria. We will look at what the reason why the patient might have one, pending our culture results.
Dr. Vanetta rushes to the microbiology lab to study the sample Dr. Konasevich has extracted from Meredith's brain. Soon after, Meredith emerges from surgery.
I remember seeing my mom and seeing a friend and waking up and I just remember being so confused as to what was going on and what had just happened.
When I first saw Meredith, there was a real sense of relief, I guess, because I was physically seeing my child finally after having her endure all these things. Her eyes were not quite in sync. That there was also some droopiness with her eye.
For the next 24 hours, Meredith is closely monitored.
Aspiration can lead to effective cure along with the antibiotics. I was very hopeful that it would be able to do that in Meredith's case.
But Dr. Konasevich won't know for sure if he has to do another surgery until he sees how Meredith is responding to treatment. For the time being, it's a waiting game.
I was feeling a little bit better, a little bit more with it, but not full. There was still something wrong with me. I was still progressively, it was kind of standing still, but not getting any better.
Meredith had a very good Sunday. She had a visit from her sister and brother and father, so that was a very good meeting. But on Monday morning, we were greeted with a visit from Dr. Konasevich.
Meredith started complaining of increased headache and still had some word-finding difficulty. A repeat CAT scan at that time showed expansion of the abscess and evidence of increased swelling of the brain. So the next step for Meredith at this point meant undergoing a left craniotomy.
A craniotomy involves removing a portion of the skull bone and operating on the brain tissue beneath. The bone is replaced at the end of the surgery. It's a risky procedure and can result in seizures, brain damage, and even death.
Well, Meredith was very brave and courageous, but she did say to me several times, "Mommy, I'm really scared." And I assured her that she had every right to be scared and that I was scared too. And to hear that your child is scared is just a very difficult thing when you're just so scared yourself.
Ago, Meredith Estus was healthy and excitedly planning for her freshman year of college. Now, she's about to undergo her second brain surgery in 5 days.
I think that when your child has to undergo brain surgery, you just wonder all sorts of things, if they're going to be ever the same.
At 8 a.m. on Tuesday, neurosurgeon Stefan Konasevich makes his first incision.
The abnormal portion of the brain in Meredith appeared to be discolored. Also, there had been evidence of some underlying pus that had emanated from that part of the brain. I was able to excise the majority, if not all, of the abnormal appearing brain. After having done this, I was able to close back the covering of the brain and put back the skull and sew back the scalp.
I waited for her to come out of it.
I just remember feeling a lot better and feeling almost like there was like a load off my shoulders. Like I just felt like I was me again.
And she wanted 3 things. She wanted apple juice, she wanted water, and she wanted chocolate milk. And very adamant in her delivery of those demands, I knew that I think I was getting my child back.
But Meredith is far from out of the woods.
Meredith was still monitored very closely in the intensive care unit. We continued giving her medications to prevent effects from the craniotomy, such as anti-seizure medication. We continued giving her anti-swelling medication. We continued monitoring very closely for her neurological status.
There was still an underlying concern because Dr. Konasevich conveyed that this bacteria may still be there, and there would be follow-up tests and MRIs done to gauge whether the bacteria growth was enlarging or whether it was fading away.
Meredith steadily recovers, but the family is still very concerned about the mysterious cause of Meredith's symptoms and terrified they will return. Finally, on October 3rd, a month since all of this began, the results of the culture arrive.
It was 3 or 4 days later when we had the final cultures back with Fusobacterium. Fusobacterium is what we call an obligate anaerobe. It's a bacteria that only can grow without the presence of oxygen. That's why Fusobacterium tends to be in abscesses.
Based on the presence of the Fusobacterium, Dr. Vanetta is able to give a name to Meredith's malady.
She had Lemierre's disease.
Lemierre's disease is a complication of a severe sore throat caused by a particular kind of bacteria called Fusobacterium. It occurs when the Fusobacterium cells that cause the initial sore throat spread to form a blood clot in the jugular vein. Pieces of the clot then break off, infect the blood, and travel through the bloodstream to form abscesses in other parts of the body.
Pus can metastasize through the veins and can go to the brain, can go to the lungs, can go to basically any part of the body and cause this metastatic sites of infection. And that's how Meredith's infection spread.
Fusobacterium can be found in most people's gastrointestinal and oral tracts and is usually harmless. But for an unlucky few, the bacterium can cause a life-threatening infection.
Fusobacterium is a very rare infection to have. It's reported and felt to occur less than in 1 in a million patients. And if untreated, her risk of dying in a matter of a few days would have been very great.
They told me that it had affected my temporal lobe, which affected my memory, which explained a lot.
Because it can easily be treated with antibiotics, Like polio, Lemierre's is considered a disease of the past. Many doctors have never even heard of it, making it difficult to diagnose.
Lemierre syndrome is kind of called the forgotten disease because of the fact that it used to occur fairly frequently prior to the days that we had very effective antibiotics.
But the rise in Lemierre's cases in recent years is troubling to many infectious disease doctors.
Because there is this emerging concern in the United States that we are overusing antibiotics, we have been encouraging our physicians in the United States to not use antibiotics in a needless situation. And I think it's because we have stopped using antibiotics so freely in the setting of a sore throat. We are starting to see more cases of Lemierre syndrome emerging now in the last decade.
Once the bacterium is identified, Dr. Vanetta immediately designs a treatment regimen for Meredith.
She received 6 weeks of intravenous and oral antibiotic treatment.
They put a catheter in to my side, and every day I would have to insert 4 different liquids in it. And I told my friends about that, and they're like, oh man, that really sucks. And I was like, well, no, it's not that big of a deal. Like, after all else of what I had gone through, like, it was like the smallest thing.
By the next fall, having completed the antibiotic regimen, she's fully recovered and ready to start her sophomore year right.
Meredith is great today. She is a university student, doing well in her studies, and has a very spunky nature to her. She does not complain of any headaches. She doesn't have any visual problems. Her speech is intact. Her memory is also very good.
You can't tell that she had brain surgery at all. She's a really good student. She's still really energetic and optimistic and fun to hang out with.
Well, Meredith today is just amazing. I really admire her courage, her determination, her resiliency. I think she's made a remarkable recovery, and I think that she's really come a long ways from those dark days in the hospital.
After having Lemierre's, it seems like little activities that one takes for granted, like I appreciate a little bit more because I'm able to appreciate them. Like I'm able to do maybe what some people that had it aren't able to do because they're no longer around.
Meredith was hit so fast and hard with her symptoms, she didn't know what was happening to her. But Doug Posnanski was agonizingly aware as his body mysteriously began to fall apart.
The first time that I felt something was wrong was the last Saturday in February of 2004. And I went to go get a haircut, and when I was driving, I started getting kind of lightheaded and flushing and sweating and getting some chills. And I started having some lower back pain.
Alarmed by the unexpected symptoms, Doug cancels his appointment and makes his way over to his girlfriend's house.
Doug looked terrible, pale. He was sweaty. He was hot to the touch. He looked like he got run over by a train. I took his temperature. It was 103.
Michelle insists that Doug go to the local urgent care facility for a complete workup.
It was late in the day, Saturday. Right before they closed, they squeezed me in. They did me the favor. And, when I got there, they checked me out. They saw my temperature was over 103. And, they did a urinalysis.
The results show blood, protein, and a large amount of white blood cells, which indicate Doug's body is fighting off an infection.
They told me I had either like a bladder or a kidney infection. I didn't think it'd be a big major issue.
He's given antibiotics and sent home. After a few days, he begins to feel better, and by the end of the week, Doug is back to his old self. But then, just a week later, he experiences another alarming incident.
Michelle and I were driving to a wedding about a half hour into the ride. I just started feeling strange. I started flushing. I just started, my face, I felt like blood rushing to my face. I felt like I was getting, red in the face, and I started getting, dizzy. And, within about 10 or 15 minutes, I was pretty disoriented. And I was holding my head. I had a lot of pain in my head.
I was talking to him, and he just seemed really spaced out. It was in his eyes. He was looking at me like he didn't know who I was, and he just seemed like he was on another planet. I got scared, and I said, well, maybe we should go to the emergency room.
Michelle said, you're starting to really worry me. And I said, I'm starting to worry myself, too.
Doug Posnanski has always been so healthy, he's rarely had cause to go to the doctor. But a multitude of strange symptoms have just landed Doug in the emergency room for the second time in 2 weeks.
I'd never felt this way before. I just felt like something just like hit me, like something just kind of came over me. It was a very strange and very scary feeling, you know, when you feel disoriented like that.
At the ER, blood tests and a urinalysis come back normal.
The ER doctors really didn't get too into it. I worked out that day, I tanned, I ran around to get to the wedding, and I was probably on like 4 hours sleep. So they said, you've probably just overdone it.
Emergency room doctor said that it was dehydration. They gave him instructions to drink a lot more fluids and have some rest.
When I was in the ER, they discharged me that same day, and they said to follow up with my regular doctor, which, not having one, I went back to urgent care.
While doing a full workup, the urgent care doctors find an unexpected problem.
They ended up doing an EKG, which was abnormal, and they referred me to a cardiologist. What they wanted to do was an echocardiogram. There's no history of heart problems in the family, and going into the waiting room at the cardiologist was very interesting to me, because at the time I was 28 years old, and I walk in, and you know, the average age was 65 plus, and I literally had people looking at me saying, what is this guy doing here?
The EKG reveals pulmonary valve stenosis, which is an obstruction of blood outflow from the heart to the lungs, as well as an enlargement of the right ventricle of the heart.
When I heard that he might have some type of disorder with his heart, I was scared for him, but I didn't let on that I was scared for him.
The cardiologist really wasn't concerned. She said, you know, the testing today is so specific and it's so technical that it picks up every little thing, and if they put the leads on just a little bit off, it could throw off the numbers slightly, and that's probably what had happened, and it was just a bad reading, and that everything was fine. It's not a major issue.
Despite the specialist's assurance that he's fine, over the next few weeks, Doug continues to feel unwell.
I had tingling in my hands, numbing, you know, fevers, you know, like a constant low-grade fever, which was pretty freaky, and also a headache that would really come on pretty strong and wouldn't go away. It felt like somebody hit me with a brick in the head. I started going back to urgent care. Over the course of 2 weeks, I was there pretty much every other day.
But each trip to the urgent care has the same results. No one can find anything wrong with him.
And saw them and said, look, there's something not right here. This is starting to freak me out a little bit.
Then Doug starts to exhibit a scary new symptom.
He was starting to have a memory lapse, which was very unusual for him. Doug was great with names, faces, with people, with facts.
Doug did a 180. Instead of being this really outgoing type of person, he became a recluse, wanted to stay home all day, didn't want to be around people. So it was very difficult.
Equally alarming, Doug begins dropping weight.
At first 10 pounds, then 20 pounds, then even more.
I went from 220 pounds, you know, muscle from, you know, working out and being active to, you know, 180 pounds, which was very scary.
A month and a half after his symptoms first began, Doug has become so sick that he's no longer able to work.
I had left my job and I was on disability.
It was very difficult when he declared disability. Doug likes to work, and he just felt that he had no purpose.
After endless visits to the urgent care facility and no definitive diagnosis, Doug uses his time at home to seek answers on the internet.
I started doing research and reading, and I was on the computer 4, 5, 6 hours a day on average, reading on different conditions and trying to piece together my own symptoms for some sort of outcome. I basically became my own doctor at that point.
He was willing to do the research and study and find out. He was determined to figure out what was wrong with him, and he didn't stop.
Doug was relentless in his search to find an answer to why he was feeling all these symptoms. He wouldn't give up.
Over the next 6 weeks, Doug visits a slew of doctors in his quest for a diagnosis. An endocrinologist, urologist, neurologist, new general practitioners, and an infectious disease doctor. All come back with the same reply. There's nothing really wrong.
Doug and I were really frustrated that they couldn't figure out what was wrong. A lot of the tests showed that there was some type of inflammation here, but they really couldn't pinpoint what was causing it. We just needed to find the right doctor.
No one was able to determine what was wrong with him. I was surprised. I could see physically with the weight loss, he didn't look right. His behavior was a little erratic. He was anxious, and there was definitely something wrong there.
Then, one ER doctor makes a suggestion that takes Doug by surprise.
They kind of got sick of seeing me in their waiting room. I remember the doctor coming in, and he had a little brochure with him, and the brochure was on like panic attacks and anxiety disorder. And he prescribed me Paxil. I disagreed with him right away. I said, no, I really don't think that's what it is, and I really prefer not to take like an antidepressant.
Doug continues his search for an answer, but increasingly, he's told by the doctors that it could all be in his head.
I know how I feel, and I know it's not something that's in my head or mental. There's something physically wrong with me, and I could feel it, and I knew it.
Something wasn't right, and although stress, I believe, can add to that and maybe panicking and overreacting, but it wasn't the underlying condition.
When I started telling these doctors, there's something in me, I don't know if it's a bacteria, I don't know what it is, it's slowly killing me, and you're gonna figure this out when you're doing the autopsy.
Doug Posnanski has been suffering for weeks from strange symptoms that no doctor is able to diagnose. He's feeling progressively terrible and fears a diagnosis will never be found.
Physically, I was a mess. Emotionally, it was taking its toll, but none of these doctors really were able to put their finger on any of it.
Then, one night, things suddenly take a turn for the worse.
Easter Sunday, 2004, I woke up in the middle of the night and I couldn't catch my breath, and it felt like a stabbing sensation in my chest, and I had never felt anything like that before, and I was scared to death.
Yet again, Doug rushes to the ER.
They were very concerned that I was having a pulmonary embolism, and that's actually a blood clot in your lungs, which can and will kill you. So, they rushed me in, stat, and they did at least tests and scans of my lungs.
But as always, all results come back normal.
Then they started with the old, well, maybe it's anxiety, you had a panic attack. And I look up and there's a nice woman sitting there with a clipboard and, was there to do an evaluation, which I come to find out was a psych evaluation.
Doug is desperate to prove that there really is something physically wrong and starts visiting other urgent care facilities in the area almost every day for the next 2 weeks. Then, on April 20th, 2 months after the onset of his symptoms, Doug is out with Michelle when he experiences the worst episode in his chest yet.
Doug had a hard time taking in a breath. He was walking and he was holding his chest and saying that he had difficulty breathing.
In the past, I had felt, short of breath, tightness, like kind of in my throat. Some chest pain, the stabbing, but this was different. I felt like a pounding in my chest, and it was like radiating up. I thought I was gonna have a stroke or something. And I looked at Michelle and I said, I need to get to the nearest hospital. I think this is it.
Doug rushes to the closest ER, where they administer a pulmonary function test, which measures how well oxygenated blood is able to move from the airspace of the lungs into the heart. The results are shocking.
The saturation rate should be like 80, 90, shows the level of oxygen in your blood. I was in the 50s.
Doug is admitted to the medical center for testing and observation.
One of the doctors came in and right away put his light in my eyes. I remember him saying to me, your pupils are just so dilated. There's something majorly wrong here. There's a neurological problem here.
But again, all the tests administered return with negative results, and Doug is released from the hospital.
After I was discharged from the hospital in the city, I was back home in New Jersey and, started again, stabbing pain, chest pain, shortness of breath. Felt like my throat was closing. So back to the ER, and the doctor who was there at the time was terrific. He stepped in and said, there's something clearly wrong, there's something autoimmune. We need to admit him and really do an all full-on workup.
When one of the doctors told him that he might have MS or some type of autoimmune disease, I was scared for him because he was about 28 years old at the time and he had everything to live for.
Doug is admitted to the hospital in New Jersey for extensive testing.
I just felt if something was going to happen, at least I'd be in the hospital, I'd have a chance that they'd be able to help me and save me. I felt that if I was at home, there were many nights where I went to bed thinking I might not wake up.
Doug's time at the medical center begins with days of heavy cardiac testing.
They did more tests on me than I knew ever existed. I really felt like the world's largest guinea pig.
Many, as usual, come back normal, but a spinal CT scan reveals inflammation of the lungs, enlarged lymph nodes, and an enlarged spleen.
What they had found was through their studies that I had pericarditis, the inflammation of the sac around the heart, which was pretty scary to me. And at the same time, a second pulmonologist said I had a touch of pleurisy, which is inflammation of the lining around the lungs. So when you put it all together, it's different varying degrees of inflammation with different vital organs.
However, an infectious disease doctor reports Doug's blood tests are coming back negative for all diseases.
When I stayed at the hospital in New Jersey for the week, it was like a revolving door of different doctors. And, they were all doing their workups. They were finding some things here and there. Again, nobody really pieced it together. It was like the doctors had a tug of war. It's autoimmune, it's in his head, it's autoimmune, it's in his head. And I just sat there pounding my fist literally on the table saying, there's something wrong. It's physical, and you're going to figure it out when I'm dead.
After 6 days, scores of tests, and no conclusive results, Doug is discharged. He's told that something's definitely wrong, but it's at such an early stage that the doctors can't identify it. And right now, there's nothing they can do.
I was forcibly discharged. They pretty much had to pry me out of the bed and throw me out of the hospital. Because I said, look, I don't want to leave. When you find out what's wrong with me, I'll leave. Nobody came to me with a diagnosis. And that was a very difficult thing for me to accept.
Doug and Michelle return home, discouraged.
Doug decided to write his will out on a napkin. And that really depressed me because I saw that he had given up.
Doug's mood is morbid. He really felt that this is it. They're not going to help me. I'm done.
After being discharged from the hospital, my personality was gone. I just didn't have one anymore. I just sat there and stared at the wall. I just felt so kind of isolated, alone.
He had no appetite at all. He looked really drawn in, looked almost like a cancer patient. His gray hair started graying more. He looked terrible.
Then, one day, while out to dinner nearly 4 months after the onset of his symptoms, an old friend approaches him.
I was at a restaurant, and I ran into an acquaintance, and, he took one look at me, and he had heard what I was going through, and he said, I think I know what the problem is. And I remember him vividly reaching in his pocket, taking out his business card, turning it over, and writing a doctor's phone number. Dr. Leslie Fine, you need to see this woman. Like yesterday, she's going to save your life.
Doug makes an appointment to see Dr. Fine in early May 2004.
And I remember walking into her office and filling out the paperwork, and she had a symptom checklist of about 50 symptoms, of which I had about 35. And I remember handing the sheets back to her receptionist, and about 3 minutes later, Dr. Fine came out, from her office and got me.
When I saw him sitting in the waiting room, he was very pale, very sweaty. He had loss of balance. He was confused and unable to verbalize, unable to answer questions, shaky. He just looked like somebody that needed to be seen immediately.
Dr. Fine said, I need to talk to you, and brought me right in right away and said, you need help. I would bet my house I know what's wrong with you.
Posnanski has been suffering for 5 months with blinding headaches, stabbing chest pains, and tingling in his extremities, and no one has been able to tell him why. He has all but given up hope when he meets Dr. Leslie Fine, who thinks she knows exactly what's wrong.
I felt very confident in her right away, when I met her and I saw how aggressive she was.
Dr. Fine immediately sends Doug to get a spinal tap and a brain SPECT scan, a radiological study which looks at the flow of blood in the brain.
He had a very abnormal SPECT scan. Evidence of inflammation of the brain, which is what we call encephalitis.
I vividly remember getting the call. I was laying in bed and just really could barely move. And I remember her calling me at 8:30 in the morning because the test showed flying colors positive for Lyme disease.
Lyme disease is caused by the bite of a deer tick infected with the bacteria Borrelia. The tick embeds itself in the skin and discharges the Borrelia into the bloodstream, which can then wreak havoc throughout the body.
There are a lot of different strains of Lyme, and maybe some strains go to the nervous system more readily than others, and some strains go to the joints.
Typical symptoms include headache, fever, and fatigue, but in its advanced stages, Lyme is even more difficult to diagnose because of its ability to cause other illnesses.
Manifestations of Lyme are often not just directly from the infection. It was first described in the early 80s, and it was known then that Lyme disease could trigger rheumatoid arthritis and lupus and other autoimmune diseases. Because it has the ability to trigger other things, it's not just simply an infection.
And testing for Lyme presents a whole new set of issues.
I was tested many times by different doctors for Lyme, and they said, no, you're negative.
There's no one test that will specifically diagnose a case of Lyme. There are multiple tests that can be performed, and people can test negative on all of them and still have the disease. We don't know why all the patients who test negative. Some of the reasons are because we're not testing for all the strains yet.
In Doug's case, there was something else that made diagnosis elusive.
The test picks up the antibodies, and if you get very sick and your immune system is basically non-existent, you're not producing antibodies, so you're not going to pick them up in a test.
Most cases of Lyme are accompanied by a bullseye rash at the site of the bite, which many mistake for an ordinary bug bite.
Doug recalled having a lump on his scalp in November.
I noticed in the shower, shampooing my hair, and I had a lump, and I remember feeling it and saying, this really hurts.
He asked me to look at it, and I told him, well, it looks infected.
And I will never forget this. She said, you have a lump there. It's strawberry red, about, size a little bit bigger than a quarter, with a clear center.
And then developed symptoms around February or March. This would be a classic presentation of an undiagnosed, untreated tick bite.
Treatment for Lyme presents almost as many difficulties as diagnosis.
The treatment for Lyme is complicated and controversial. There is no consensus within the medical community about what the appropriate treatment is, what the duration is.
I started on oral antibiotics, and they helped slightly, but based on where I was at and how long I was sick and with the neurological involvement, I very quickly switched up to IV, intravenous antibiotics.
Doug was diagnosed and treated just in the nick of time, but not all patients are so lucky.
Doug would have gotten progressively more tired or confused. You generally see people just becoming progressively unable to function. You die, usually if you have cardiac involvement that's not diagnosed.
It was like a weight off my chest. I felt like I had like a garbage truck parked on my chest, and it just like rolled off me, and I felt like I could breathe a little easier.
Today, nearly 3 years after starting the antibiotics, Doug's life is finally back on track.
I'm 100% back to normal, thank God. After about 1.5 years of treatment, 6 months of intravenous, and about 1 year of oral antibiotics, I'm back where I need to be. Life is good, and back to normal.